and get started today. So hello, and thank you for joining us today for Healthcare Professionals' Attitudes Towards Social Media Usage. My name is Elizabeth Reed, and I'm the Project Manager of Healthcare Professional Education at the GW Cancer Institute. Before we get started, I would like to take a few minutes to go over housekeeping remarks. We ask everyone to keep their phones on mute to avoid any background noise and disruption during the program. Due to the large audience size, we will utilize the Q&A feature for this webinar. You will see the Q&A box at the bottom right hand of your screen. If at any time during the presentation you have a question, please type it in and we will address it during the Q&A portion at the end of the webinar. The questions are anonymous, and I will repeat the question. We will take questions at the end of the presentation, but feel free to write questions in the Q&A box as we go, and we will make sure to answer them during the time allotted. To reduce the background noise and enhance communication quality, we will utilize this feature for all questions during the webinar. I would like to take a moment to review today's agenda. Ann Willis will provide an overview of the Center for the Advancement of Cancer Survivorship, Navigation and Policy, followed by me presenting on the results of our social media survey. We will wrap up the webinar with some Q&A from the participants. Reminder that due to the large audience today, we will take Q&A through the Q&A feature on your screen. I would now like to turn it over to Ann.
Hi, thank you, Liz. I'm Ann Willis. I'm a director of our Center for the Advancement of Cancer Survivorship, Navigation and Policy, which we affectionately call CA-SNAP. So the center was created in 2009 through a generous grant from the Pfizer Global Health Partnership Program. And the mission of the center is to advance cancer survivorship and patient navigation efforts locally and nationally through education and training, policy analysis, outreach, and research. The center offers survivorship and navigation resources that are available online through our website, as well as through a free monthly e-newsletter. And additional material is sent through the CA-SNAP listserv, which has over 2,000 subscribers. And we write white papers, create case studies, and work cooperatively with other healthcare organizations to advance patient-centered care. So we have policy papers on our website to educate patients and the public about the impact of the Affordable Care Act. And then we also share summaries of meetings and roundtables that we posted to catalyze patient navigation, cancer survivorship, and patient-centered care initiatives. And CA-SNAP is best known for some of its signature trainings, one of those being the executive training on navigation and survivorship. And this training has been a 2-day training program that equips healthcare professionals with the tools needed to launch and sustain navigation programs, which are 2 cornerstones of patient-centered care. And we bring participants in and they learn strategic planning techniques for developing, implementing, evaluating, and sustaining navigation and survivorship programs. And since we launched the program in 2010, we've trained over 250 healthcare professionals. And we are very excited. We were recently awarded funding from the Centers for Disease Control and Prevention to provide technical assistance and support to state comprehensive cancer control programs. So as part of this newly funded project, we're actually going to be transitioning the executive training from an in-person format to an online format, and we'll make it available free for anyone who's interested. And then we'll also be developing other new online training and education programs to help enhance cancer control activities across the country. So today's webinar is part of the CA-SNAP monthly webinar series launched in April 2013. And through this webinar series, we feature a variety of topics related to navigation and survivorship. And we pick those topics based on feedback from you all, from healthcare professionals across the country. And this webinar is the second webinar we've offered that's focused on some of our research initiatives. So I wanted to spend just one more minute talking about some of our past and future research that you will be hearing about soon. So our first research webinar was based on results from our best practices in navigation and survivorship survey. We conducted a national web-based survey of healthcare professionals at institutions with patient navigation and or clinical survivorship programs. And the survey asked respondents to identify patient navigation caseload, measures tracked, tracking tools, clinical tools, funding streams, challenges, and recommendations for financial sustainability. And we had 100 respondents complete the survey. And then we presented this information on a webinar that's been archived and is available for free on our website. And we'll have the link to that later on in the presentation. This webinar, which Liz will discuss in greater detail, is on the results of our recent survey on social media usage. And then in the next several months, we'll bring you the latest research results from other projects that we're working on as well. That includes a set of surveys we conducted with healthcare professionals and that we will conduct with cancer survivors to identify best practices for education classes specifically on post-treatment issues and management of care for cancer survivors. And we also received funding from the Patient-Centered Outcomes Research Institute for a project called Evaluating Cancer Survivorship Care Models. And we're really excited about this project, and it's underway right now. And the project is a partnership between the GW Cancer Institute, the GW School of Public Health and Health Services, and the GW Medical Faculty Associates. And we also have an advisory board with representatives from the American Cancer Society, Livestrong, Cancer Support Community, and the Commission on Cancer, as well as survivors, clinicians, and survivorship researchers. And the goal of the project is to compare the effectiveness of different models of care. And the key activities include focus groups and a national survey of cancer survivors to identify priority outcomes, services, and gaps from the survivor perspective, and an environmental scan of Commission on Cancer accredited institutions to determine what care is currently being provided and to help inform more descriptive models of care. And then the last main activity is selecting 3 model types to compare their effectiveness on those outcomes that patients identify as the most important. So we have more information about the project on our website in the research section, and we'll be providing updates as we progress. And then one other research project that we plan to report the results on is our Patient Navigator Competencies Project. We've developed a framework that differentiates different types of navigators. So it's focused on community health workers, patient navigators, which are sometimes called lay navigators, and then nurse and social work navigators. So we will be validating the framework competencies through a national survey of patient navigators to achieve consensus on patient navigator-specific competencies so that we can then build a free online training for patient navigators. So we have many opportunities for you all to participate in research and learn about our findings, and we will list the opportunities in our monthly e-newsletter. Our goal is really to share the findings so that we can provide you with information to help you provide patient-centered care. And if there are any topics that you would like to know more about, then we would love to get your feedback, and feel free to reach out to us with that. So thank you so much for joining us today to hear the results of our latest research. I will now introduce Liz. So Elizabeth Reed is a project manager for healthcare professional education at the George Washington University Cancer Institute. She manages the development and delivery of education and training programs for healthcare professionals for the Division of Cancer Survivorship, the Center for the Advancement of Cancer Survivorship Navigation and Policy, and for the National Cancer Survivorship Resource Center. She's responsible for conceptualizing, planning, designing, developing, implementing, and evaluating programs and projects to reduce cancer health disparities and improve quality of life for those affected by cancer. She led the management and development of the Guide for Program Development and Program Development Workbook that were added to the curricula of the executive training in 2012. As part of CASNAP, Liz recently launched the free monthly webinar series that you're participating on. We've had over 1,300 healthcare professionals who've participated. And Liz is also looking to expand the reach of CASNAP through social media and online trainings. And Liz has a Master's of Public Administration and Nonprofit Management from George Mason University. So with that, I will turn it over to you, Liz.
Thank you, Anne. I'm so pleased to present today on the results of GWCI's recent initiative, Healthcare Professionals' Attitudes Towards Social Media Usage. The study was conducted with the assistance of the graduate student, Latoya Norman, and I would like to acknowledge her contributions to this study. So for today, I will provide a brief overview of social media and social media integration in healthcare. I will then describe the healthcare professionals' attitudes towards social media usage survey and discuss the results. So let's get started. So what is social media? One definition describes it as websites and applications that enable users to create and share content or to participate in social networking. You might see slight variations to this definition, but this is the general essence of social media, which remains the same. So what are some examples of social media? Well, examples include Facebook, Twitter, YouTube, Pinterest, LinkedIn, Instagram, Flickr, Google+, and many, many more. So what is the social media buzz all about? Well, the number of Facebook users is about 3 times the population of America, with on a monthly average 850 million users. With 175 tweets in 2012, the average Twitter user has 307 tweets, and the U.S. is the #1 country for using Twitter. In addition, YouTube reaches more adults than cable television, which suggests though the use of TV is declining, the demand for programming is increasing through other channels. And many say that this is just the tip of the iceberg for social media. Social media is still in its early stages of growth, and we are only seeing the beginning of the impact of social media on business, the economy, and society. So why are so many people using social media? People are using social media to obtain information, and they are doing so on multiple sites. Social media provides for an instantaneous connection to people and information across the world. So in a nutshell, social media provides individuals with constant, affordable access. So constant in that it is always there at your leisure whenever you want to use it. The onus is on the user. Affordable, you just need a device or you can rent one or use a computer at libraries. There is Wi-Fi internet access at low cost or free in many public spaces. You can access it from anywhere, at work, at home, on your laptop, iPad, or tablet, smartphone, and unfortunately sometimes at restaurants, and as mentioned, public spaces, and the list is growing. So some uses of social media for health communication include dissemination of health and safety information, expanded reach through networks to include a broader and diverse population, tailored health messages, and to facilitate interaction, dialogue, and connection with the public. And this comes from the Health Communicators Social Media Toolkit created by the CDC. And the CDC also states that the 2 forces driving online conversations are availability and increased use. So there has been an uptick in the integration and adoption of technology in the healthcare system, such as electronic medical records, use of laptops, iPads, smartphones, and websites and applications to provide and store information. Healthcare professionals are beginning to use social media for professional development. A 2011 study from the American Medical Association found that 67% of physicians were using social media for professional use. Another survey in 2010 by the AMA also revealed that nurses are turning to social media for professional development. However, little research exists about healthcare professionals' use of social media sites, and no known research exists about the use of social media to educate healthcare professionals on patient navigation and survivorship. With the growth of social media and emergence of healthcare organizations integrating and adopting social media as a means of communication, marketing, and information sharing, such as the CDC, CA-SNAP set out to better understand the needs of healthcare professionals in patient navigation and survivorship in their use and desired use of social media as a means of professional development. As Anne mentioned, the GWCI Center for the Advancement of Cancer Survivorship Navigation and Policy is committed to advancing patient navigation and cancer survivorship efforts locally and nationally through training, research, policy analysis, outreach, and education. To improve the delivery of high-quality cancer care, CA-SNAP seeks to refine communication among healthcare professionals involved in cancer care and further educate them on cancer survivorship and patient navigation, ultimately leading to improvements in health outcomes and quality of life. The purpose of this survey is to explore healthcare professionals' attitudes and perceptions towards the usage and adoption of social media as a source for professional development. In conjunction with a graduate student in the GW School of Public Health and Health Services, GWCI conducted a literature review of social media platforms and use of social media platforms by healthcare professionals, which form the basis for our research and our study. Using the technology acceptance model, the study administered a qualitative survey that assessed the perceived barriers to social media adoption, the motivations to adopt social media, attitudes towards social media, perceived ease of use, perceived usefulness, and usage of social media. What resulted was a total of 35 questions divided into 7 sections with a final open-ended question. The 7 sections included demographics, professional development, individual use of social media, employers' attitudes towards social media use, individual social media use for professional development, LinkedIn use for professional development, and Twitter use for professional development. The survey was open for 3 weeks and disseminated through the CA Snap listserv to over 1,900 subscribers. A snowball approach was used, and recipients of the survey sent it out through their own networks. 136 individuals started the survey, and 122 completed the survey. Looking at the demographics, over 50% of respondents were over 50 years of age and female. They were also predominantly non-Hispanic, about 97%, and white, over 80%. Not surprisingly, nurse and patient navigators were among the highest of respondents. Though the other category was highest, job titles included nurse navigator and varying types of navigators such as health patient educators, community health workers, and outreach specialists or coordinators, which suggests the need to better clarify types of navigators, specifically the patient navigator, as well as the differentiation between a traditional nurse and what is now called a nurse navigator. So looking at the graph, the highest percentage of respondents came from community cancer centers, followed by hospitals, health departments, or agencies. It was also reported that about 60% had a postgraduate degree. Other organizations included tribal health organizations and consulting firms. So the first set of questions we asked was related to professional development. For the purpose of this survey, professional development refers to any learning opportunity that enhances skills and knowledge to perform a specific job, duty, or task. 96% indicated that it is important or very important to obtain professional development, with a 60% seeking professional development a moderate amount or great deal per month. Here in this chart, we see that online training and in-person educational seminars and conferences are the highest sought-after sources for professional development. And then further down here, we see about 33% that indicated social media as a professional development source. We then asked about individual social media use. For the purpose of this survey, social media is defined as online or web-based platforms used as a means to create, share, and exchange information. Examples of social media include Twitter, Facebook, LinkedIn, Google+, Pinterest, Flickr, Tumblr, YouTube or Vimeo, and blogs. About 89% are using social media, with about 58% using it for both professional and personal or only professional use. For the 12% that did not use social media, the majority stated that they do not have enough time in the day for social media. So looking at this graph, we see that the main objective for social media use is to share or exchange information with peers, communicate and network with peers, and receive relevant news and events. These results are consistent with other statistics showing that information and connecting with others are the main reasons for using social media. So this reaffirms those findings. When asked about the top social media sites respondents use or would use, Facebook leads the pack with nearly 69%, followed by LinkedIn and YouTube. Other media sites also included professional association websites and Instagram, which is similar to Flickr in that it is a photo sharing platform. We then looked at employer attitudes towards social media. 4% of respondents have access to social media at work with access to Facebook, LinkedIn, YouTube or Vimeo, Google+, blogs, and Twitter. And for those who don't have access using social media, they cited concerns for using social media for personal use, privacy concerns, organizational policies, and viewing social media as a distraction were almost uniformly cited as possible reasons. Additional responses revealed employers viewing social media as useful and easy to use, but are less motivated to allow employees to use. So now looking at social media for professional development, nearly 65% find social media useful, somewhat useful, or very useful for professional development. Compared to the previous figure, which had about 57% using social media for professional development, this may indicate that those who are not using social media would find it beneficial if and when they use it. So we then asked about the top social media sites for professional development. In terms of social media use for professional development, the top two are flipped. Compared with the general social media sites, LinkedIn ranked number 1, followed by Facebook. Google Plus is also interesting on both the general social media use and professional development social media usage in its ranking, which may be worth exploring how it is used in more detail. So using the technology acceptance model that I previously mentioned, we looked at individuals' motivation to use social media. Overall, respondents, about 50%, are motivated or highly motivated to use social media for professional development, with only about 9% unmotivated. We then specifically looked at LinkedIn as a social media tool for professional development. LinkedIn, according to LinkedIn, it is the world's largest professional network with 225 million members in over 200 countries and territories around the globe. And it is a networking tool to connect the world's professionals to make them more productive and successful. We found that about 63% of respondents use LinkedIn. When asked about the LinkedIn features they most are or would most likely engage in, we found that announcements and information sharing, joining groups, and discussion boards rank the highest. And as you can see, the top 3 are about exchange of information and connecting with individuals. So then we asked specifically about what information and resources related to patient navigation and survivorship individuals would be interested in. Overall, all categories got a high response. Individuals were interested in information on online or in-person training and education programs, as well as links to articles. Overall results reveal that individuals favor the use for LinkedIn for receiving information as a useful resource for obtaining information, an easy-to-use resource, and are motivated to use LinkedIn to obtain information. So we decided to also look at Twitter as a popular social media platform. Twitter has about 7.1 million U.S. adult users and is considered a real-time microblog. When asked about how often they use Twitter, the majority of respondents indicated, about 76%, that they do not use Twitter. Looking at the graph here, about 64% indicated that they do not engage or plan to engage in Twitter features. For the types of information or resource sharing that would be helpful, again, here you see that there is little interest in Twitter use among the respondents. About 53% indicated none. So in summary, healthcare professionals use and are motivated to use social media for professional development. Employer attitudes do not inhibit individuals' use or lack of social media use. Healthcare professionals view LinkedIn as a potential resource for professional development. And more research is needed on the effectiveness of social media as an intervention to provide healthcare professionals with professional development to improve quality cancer care. So we will have the summary report of the healthcare professionals' attitudes towards social media usage up on our website in a few weeks. As a result of the findings from the survey, TA SNAP will launch a LinkedIn group to provide healthcare professionals with professional development for patient navigation and survivorship. And that launch should be coming sometime in early 2014, so look for that. And then in thinking about how best TA SNAP can benefit you, we'd like to hear what your professional development and social media needs are. What do you want to see on the TA SNAP LinkedIn group? What resources are most helpful to you? Is there other information on healthcare professionals' use of social media that would benefit you? And do you have a social media success story to tell? Please email us at casnp@gwu.edu, and we'd love to hear from you. And finally, here are some of the resources that I mentioned in the presentation today. The Pew Research Center article, the CDC's Health Communicators Social Media Toolkit, and the article on the technology acceptance model used for the survey design. Additionally, if you want some more social media statistics, there are some resources here up on the side that you can go to that I mentioned in the presentation. So with that, we will conclude the presentation for today, and we have plenty of time for questions. So if you please write your questions in the Q&A box on the screen, Anne and I will address the questions in the order that they come, and we will take questions until the end of the time allotted for the webinar. So feel free to write them in. So we have one question regarding the decision to look further into LinkedIn and Twitter versus some other social media applications such as Facebook. And one of the reasons that we did do that was from our initial research that we did on some social media platforms, suggesting that Facebook was mostly used more for a personal social media tool, as well as more for social events and things like that. So we decided to look more into LinkedIn and Twitter as potential platforms for professional development. Then I can show you the social media resources slide again. I have a question, so I'll just go back. And you will also be receiving the PowerPoint presentation as well as the recording and the evaluation for today's webinar after this as well.
So this is Anne again. While we're waiting for a few folks to continue typing, I just wanted to mention again that we were really able to do this survey with the help of LaToya Norman, who I think is on the call right now. And I just wanted to thank Liz for all of her work on this. We're really excited about providing professional development opportunities, and we want to make sure that we're doing so in a way that healthcare professionals across the country find relevant and find meaningful.
So we have another question about, do you find one platform was favored as a national platform rather than a local platform in terms of finding trainings and or resources? We didn't ask specifically about national versus local in terms of the resources that folks were searching for or looking for. Social media in general tends to be more of a global platform to look for resources, both in terms of your local and national regions as well. So we have a question about differentiating between the amount of time people spent on kind of just browsing sites versus actually participating. And yes, we did ask a few questions about how often or on average how people would go to these sites, but we didn't actually ask how long they spent on those sites, which I think is another interesting question that we might be able to use in further research, and that we will be also in the summary report we will email out to you, that will include some more of the statistics on how often people use social media or use Twitter or use LinkedIn and things like that. And yes, we will email the group with an update of when we develop the LinkedIn group, which should be shortly after the holidays. So if we don't have any other questions for today, then I just want to point you to some of the our recently launched new website that includes information on GWCI, CASNAP, and the programs and initiatives that were discussed today. Please save the date for December 18th at noon Eastern for the ACA's Impact on Cancer Care, What's Ahead in 2014. We hope that you will join us again, and following this webinar, you will receive an email with the recording evaluation survey to provide us with feedback on today's webinar and today's slides. So thanks again for joining us, and we hope you have a pleasant day, and you may disconnect at this time.